Okay, welcome to episode 3 of Complete Sports Care Q&A. So today I've got with me Mark Merolli, PhD, well you're beyond that now, you're early career researcher, so Dr. Mark Merolli. So he has, he's researcher in digital health, an expert in that field. So thanks for joining us today, Mark.
Thanks, Dave. I'm glad we're doing this.
So firstly, can you tell us a little bit about your research journey and where you spend or focus a lot of your time at the moment?
Yeah, so I guess much like yourself, Dave, obviously my clinical background, I've been a physio for about 15 years now. My clinical background is very typically musculoskeletal and private practice, a bit like our setting at Complete Sports Care. So that background in musculoskeletal conditions, and I've sort of done a fair bit of work in professional sport over the years as well. But yeah, look, I guess as you said, I'm a physiotherapist who kind of found himself in a very unique position, I think, as to, I think, being quite interested in technology. Always have been, from a kind of work, research, academic sense, probably about 10 years or so formally. And like you said, I instead of probably taking a typical career path and doing a clinically based PhD, I kind of wanted to merge my sort of interest in technology, digital technology, with what I do as a physio. And so I think it kind of takes me back probably so I finished my PhD 6 years ago now. So it's actually almost bordering on not being an ECR anymore. But when I kind of came to wanting to do a PhD, I was quite interested essentially how sort of the advent really of things like smartphones and how much people were using the internet and social media and mobile apps, and how people were sort of, presenting to physiotherapists and other health professionals, sort of incorporating these sorts of things as part of their overall self-management and clinical management. And it's kind of what brought me to here, really, a physio with a research interest in technology.
COVID-19, what a year 2020 was. There's obviously not many industries that haven't really changed as a result of the pandemic. But can you outline how it's affected healthcare, sort of from your perspective in terms of technology and those sorts of things, and how the industry has adapted over the last 12 months?
Well, yeah, I think a lot of the sort of thoughts and comments in this space probably wouldn't sound all that revolutionary or unexpected at this juncture. I mean, you're absolutely right. The obvious is that COVID was very unexpected for us. So much of this whole kind of caper around upheaval of healthcare has very much been one born out of disruption, out of necessity, out of urgency. I think we're relatively fortunate in the healthcare sphere in that we sort of have recognized the sort of emergence, the possibilities, the role, the impact of technology can have on healthcare. I don't think it's sort of new that, healthcare has embraced the internet and online health information, patient education videos, as I said, activity trackers and all these other sorts of devices and things like that. These sorts of things have been kind of creeping along, and certainly, well, not creeping along, really, growing in their uptake in healthcare on the whole. And obviously kind of COVID hit and it really just accelerated all of that. Physiotherapists and healthcare professionals have been playing with, and some more than others, with telehealth, doing kind of like what you and I are doing here and conducting consultations over videos for a long time. Doctors have frequently conducted telephone consultations. The psychology sphere has been one that's kind of pioneered telehealth for a very long time. So I think, COVID hits, and that interest and that side interest for a lot of people kind of became urgent and necessary. Yeah. So COVID certainly moved us forward probably about 5 or 10 years in a very short period of time.
Do you think some of that stuff is here to stay? Like, do you think sort of some of these changes in the way we go about consultations now, or maybe the use of technology is here to stay, or we eventually go back to the way things were when this virus eventually goes away?
No, look, I mean, absolutely. I think, kind of born out of any disruption, really, sort of disruption is often one of the major catalysts for change. And sometimes once you've let the genie out of the bottle, it's you don't put it back in. And so for in many ways that's a good thing. I really do think that a lot of this, technology probably is going to start finding its way, into sort of the overall fabric of what we do and hang around a little bit. How much or how little, sort of, I think, quite case dependent and context dependent, etc. So in many ways, I think some of this stuff is most certainly here to stay. For the rest of it, it's been a useful, almost, as I said, research term, pilot study for how we could kind of do it better in future. So I definitely think it's, it's here to stay, but, it's kind of, on one end of the spectrum, you've got full adoption. And on the other end, you're obviously reverting back completely. So it's going to somewhere, I think, be kind of a meet in the middle.
So I wanted to spend a little bit of time on telehealth particular today, because this is something where maybe a few people obviously may have experienced it over the last 12 months and may have a few, other people may have a few questions about it as well.
Yeah, of course.
So firstly, what is telehealth and how does it differ from a standard healthcare appointment?
Essentially, we're really just talking about that kind of synergy and the merging of, information communication technologies with, the sort of traditional means of delivering healthcare. So in that sense, it's kind of any healthcare intervention delivered using technology. So a lot of people probably understand it. The most common comprehension of telehealth is where we have a consultation, whereby the health professional, the physio, and the patient come together simultaneously, say, either over the phone or on a video, so Zoom, FaceTime, Skype, etc. Most of the time, we tend to sort of liken that to sort of, we call it the synchronous or the live effect. So, us engaging like this over a video platform, be considered telehealth. Having a phone call live with your physio or your health professional, telehealth. But we also sort of don't want to forget some of the kind of, as I said, the asynchronous stuff as well. So, where this, as part of this kind of whole treatment paradigm, where things like email and mobile apps and, transmission of files and videos and, ongoing education. So it's not just the kind of, live stream type stuff that we're doing now, but certainly, taking into consideration some of the other metrics that we might monitor as part of someone's care, So as I said, being able to access a client, so sharing your step count. These are some of the sorts of things that technology allows us to do as part of that overall intervention. Yeah. Where it differs from face-to-face, obviously, I guess in no uncertain term, is just that not being physically located in the same space, really. So, and as we've seen with COVID-19, we've all been kind of stuck in homes and remotely located. So hence, a platform like this allows us to still sort of maintain some sort of level of healthcare or intervention.
So let's, I suppose, get into the mechanics of it a little bit.
Yeah.
If we're thinking about, like one of these synchronous sort of appointments, let's say over Zoom or similar, how would a physio go about assessing someone in a telehealth consult?
Yep. So I mean, it's sort of a kind of a complete picture, really built up with sort of interactive parts. Yeah, I guess one of the first things really, almost starts before us, Dave, as you would know, but part of that involves a lot of the time, your front of house people. We work quite closely with our admin team, etc. So, for example, that could be just as simple as a quick phone call to ascertain whether someone's suitable for a telehealth intervention, or whether it's going to work for them, or whether it sounds okay to them. So that could be just a very quick screening sort of question, or answering some simple screening questions via an email or an online form, just to ascertain that we're good to go for telehealth. But then really, otherwise we generally employ a lot of the same sort of techniques that we would otherwise do face to face. So telehealth certainly, in terms of assessing, we'll do something like this. It often starts with a nice in-depth conversation. As I said, in some spheres, in some instances, that could be supplemented or helped out by having a little bit of information before the consultation. So we can collect some of that information, as I said, by email, by short forms, questionnaires, that kind of prepare us for the consult. Or, telehealth like you and me are doing right now is, lends itself quite nice to having a good in-depth conversation. And we call that part of the physiotherapy process the subjective examination, to like the interview, the verbal exam, and telehealth, lends itself quite nicely to doing that. And then of course, what we'll want to do is actually try and conduct some assessment. And so that, in that sense, and we'll probably talk a little bit more about this sort of stuff, but certainly via the video, we can do some basic movement screening, or palpating and sort of checking areas, assessing function, overall things like that. And clearly, and this is perhaps where we differ a little bit from sort of the typical, because a lot of doctors and GPs do their telehealth via just telephone, which, as you'd appreciate, probably lends itself a bit more to some of the check-in and the verbal interviewing type stuff, but clearly we can't really assess things using that. But the video lends itself quite nicely to being able to do some of those sorts of things.
How would a physio go about treatment in a telehealth consultation?
A big part of what we do, I mean, certainly our hands are very powerful tools and we can do a lot with that, but a big part of what we do and do well as physiotherapists is education. One of the first things I tend to do, whether it be face-to-face or telehealth, the education component, particularly in cases where, initial assessments and initial appointments, when I'm first working with someone, a big part of what we do in the first instance is probably to talk it through, to talk through that clinical assessment, to talk through about our expectations, our goals, and to maybe help explain how some of the factors in a patient's life or scenarios led to their condition, and maybe how we can change some of them, avoid some of them. We can start to educate on some basic self-management strategies, heat packs, ice, when to see another health professional, exercises to do, etc. So, a big part of the treatment plan can certainly involve those sorts of things. And then we think outside the box a little bit with telehealth, because, if we're not going to be putting our hands on, in some instances, we can certainly utilize all sorts of equipment, apparatus to sort of try and simulate, some of the sorts of mobilizations or therapies we might do. Someone could use a foam roller to do some massage, using towels to help stretch and stuff like that. So, again, case dependent, right? So,
absolutely, yeah, I 100% agree. Again, just with the often even sort of from a face-to-face consultation perspective, the best parts of what we do are probably education and exercise, and again, probably telehealth really lends itself to those sorts of interventions.
I mean,
so this is an interesting one, or a big one. So, is telehealth as effective as a standard face-to-face consultation?
Yeah, absolutely. And this is something obviously we've talked about a little bit, you and I, and ourselves in our little clinic group as well. But look, for all intents and purposes, telehealth can be quite effective, and if not as effective, if not more effective in certain situations, to be fair. And this is where we start to talk about the research. And particularly in the last couple of years or few years, a lot more research. And, as I said, my bread and butter, this is a space that I play in quite intimately day to day. Digital health interventions, telehealth being one of them. There's a lot more emergent research in this space, accelerated again now in the last 12 months because of COVID, whereby researchers have conducted trials and studies looking at telehealth, say perhaps versus face-to-face or versus hands-on therapies, etc. And I guess, look, in a nutshell, in no uncertain terms, that idea of face-to-face being better or different is a little bit of a misconception in that sense. Literature is certainly starting to show, and study findings, that that telehealth can most certainly be equivocal for things like pain, function, and disability in sort of the sort of intermediate to longer term. As equivocal as a face-to-face intervention, and certainly for people living with more chronic conditions, that evidence is stronger. So, as you know, with some of the work you're doing, and things like arthritis management, chronic non-specific, low back pain, the sort of conditions that require ongoing care, whereby, the natural progression of treatment might not necessarily be a lot of hands-on anyway. Those sorts of conditions have shown quite positive results from telehealth.
Yep.
And I guess the other sort of kicker here is that some of the overlooked findings that we might not have had previously that we're starting to see with telehealth. And I think I said to you, telehealth in some spheres and some findings and some papers has started to show that a telehealth as compared to a face-to-face intervention actually might have higher patient satisfaction or better patient-practitioner communication. Yeah. And some of those reasons might be obvious, but as I said, there's certainly maybe something to be said for people who go, actually, I don't have to leave my home. I've probably got more availability in my health professional. There's less toing and froing. That's I can, not as much to cut through to have my consultation. There's a sort of element of control there for the client, the patient, a bit of self-efficacy as well. So in that sense, it is a bit of a misconception that the outcomes are different, or that they're not as good from telehealth. But certainly, again, to sort of reiterate those conditions where exercise is a big component of your rehab anyway, telehealth's been shown to be quite good.
You've spoken briefly just about patient experience, but how was it uptaken, or how was it utilised by practitioners?
Yeah, absolutely, and this probably also speaks to. So we've actually done some work that involves a few of us from the clinic, and that's actually probably okay to say accepted for publication now. So that'll come out pretty soon. But a research study that I did with Peter and Christian, so Peter Maliaris and Christian Barton, we did exactly that. Absolutely, there's work going on at Melbourne Uni, but we collaborated on a study looking at musculoskeletal practitioners. I think the mainstay of our cohort was physiotherapists, but we certainly had a variety of podiatrists and a few other allied health professionals complete our survey, looking at sort of attitudes and expectations around uptake of telehealth during COVID-19 in musculoskeletal conditions. And I mean, look, I guess the obvious things are what we talked about at the start. Yes, absolutely. There was a rapid and urgent uptake at telehealth. Interestingly, it was kind of like, pre-COVID, how much telehealth did you use? We had a kind of a median of zero, of no telehealth, all the way through to, at least 60% of caseload, during COVID. And I think some of the sorts of things that, and I mean, in terms of the caseloads and the types of things that telehealth was quite amenable for and useful for, is exactly what we were saying before, particularly in kind of acute screening, management of chronic conditions, etc. But then in terms of, say, a clinician attitude, again, some of the research, our own particular research, as well as some of the other research, is certainly showing that health professionals were quite happy with telehealth and certainly found it useful. Some of the sorts of barriers and challenges that health professionals raised were the sorts of things that, and this is interesting, this is kind of the stuff that's a bit close to my heart with my educational work that I do at the uni, which is I didn't feel prepared for conducting telehealth. And that's certainly something that's quite interesting, because when we kind of look at the sort of profile of the wider population of health consumer and their digital literacy and expectations for digital, it's kind of sort of mimics what's expected of a health professional these days, and that is sort of skills and confidence using technology. And as I said, these are some of the sorts of things in my other work that I'm trying to do to drive digital uptake and skills and knowledge amongst health professionals to operate effectively in this space. But again, I think there's still certainly probably, and again, this is, kind of commenting on one study, there's probably still an expectation that, physiotherapists will still incorporate and use and revert to, in some instances, a lot of hands-on therapy at the end of all this. And that could partly be because, again, of perception, of, patient expectation, for it's what we've always done. And a little bit of uncertainty as well around, because it's fantastic at the moment, and maybe some of the things we weren't necessarily going to touch on, but we kind of touch on now organically, that around telehealth is the incentivization and the reimbursement. Because we've known up until COVID, we didn't have, particularly in physiotherapy, any rebates available for telehealth. And so partly maybe some of those attitudes for being uncertain is because, will those rebates stick around? That might dictate whether my patients want to engage with it. if their health insurance fund is going to continue to rebate, if Medicare is going to rebate us, So there's some of the sorts of things that we've been able to tease out with research as well.
I think you've touched on this a little bit already, but
yeah.
In terms of, talking about sort of being maybe more of a blended approach and
yeah.
things going forward. But how do you see telehealth being used going forward, let's say beyond COVID-19? So what do you see its uses going forward?
Well, I mean, yeah, it kind of goes back to part of the conversation we were saying before, whereby I do think it'll stick around. I think it's shown a lot of consumers, patients, and physiotherapists alike that it's good, it can work, and then I can get results from it. So I think it's demystified things in that sense, which is good. So I think in that sense, it will continue to hang around. Again, we use that phrase blended. So I think, a lot of clinics, perhaps even like ours, will continue to offer it as a service for people who are more comfortable in that space, who like the convenience, who don't necessarily feel that they need to come in for a full, session, but, might like to check in with you, Dave, and do their exercise program just to sort of make sure you can have a quick look at their technique, that they don't have to drive all the way into the clinic, and they so for things like that. I mean, again, it's quite sort of, I think, contextual and case dependent as to what we're going to see, etc. I certainly think, again, based on the research, based on people's experiences during COVID-19, I think there's going to be a lot more confidence to continue to engage with telehealth for chronic conditions. Yep. It's the things that we do well, osteoarthritis management, low back pain management. As I said, again, the sorts of conditions that require a lot of education, self-management support and exercise. And I think, again, telehealth has proven to be quite amenable to delivering these sorts of things. So I think we'll certainly see it sticking around for that. But yeah, and as I said, I think it's certainly proven to people that, a bit like a lot of other industries are disrupted with technology, hey, I can actually do physiotherapy from the comfort of my own home. Or I can be rurally located and I can still see my physio. Yeah. And I've done it on telehealth before, so I can do it again.
Yeah, that was going to be my next question. Yeah, what about sort of rural and regional people? Will they be maybe seeking, physios and other health professionals in maybe metropolitan areas?
Absolutely, I think so. And I mean, this was probably almost the grandfather of telehealth, as to kind of why telehealth came about in the first place. Rurally and remote located individuals needing healthcare. So that was kind of the obvious case for telehealth going back years ago. And it's no different. I think, people should have confidence that they can still engage with a health professional, even if they're further out. And sort of, we certainly don't want to make assumptions, but hopefully, in 2021 and beyond, we're starting to see better connectivity, internet coverage, speeds, so that these sorts of things aren't as much of a barrier as they used to be. And then look, for the rest of it, I think, it's a bit of a watch this space, because I think now that we've sort of started to see telehealth be a bit, let's call it mainstream, we'll start to see some pretty innovative uses of it, and different business models and stuff that won't be very far away. I think we'll start to see people doing pretty interesting things with it.
Yeah, sort of feeds very nicely into my last question with you, Mark. What other technologies do you see emerging as a result of this rapid change we've had recently?
Yeah, that's a great question too. And it's kind of always enjoyable to sort of think about the future and what's coming. Look, I tend to sort of look at it a little differently and not necessarily think about it as, say, technologies not so much emerging, but more so, let's say, evolving, or almost starting to see a greater combination and integration of technologies that support more seamless telehealth. So, I guess during COVID-19 was great. As long as I can hook up with a video and get in touch with Mark or Dave, I can see my physio and we can do some stuff. But, there's clearly a lot of other technologies out there that we're already using. And some of them we talked about before. We've got, and we're already incorporating these into telehealth, but so getting lost in my virtual background there. But, we've all got, got our smartphone. We're using mobile apps. We already prescribe, various online resources and modules and videos. Some people do that quite well already, but I think what we'll probably start to see is kind of this space emerges, evolves, as you said, is a kind of more seamless integration of all that. I mean, as it sits at the moment, still as advanced as we are, a lot of these things still don't talk to each other all that fantastically. They're quite siloed. They operate, with fences around them. And I think we're certainly going to start to see better ecosystems for kind of all this stuff in one space, and that'll be good when that starts to happen. And then look, I think for everything else, and yeah, so that includes apps and smartphones and activity trackers and all that. And then look, there are certainly, other things that people have probably got experiences with, maybe they've played with it with their gaming devices or, but things like virtual reality, these have been around for a while too. But we're certainly starting to see some good mashups that incorporate a bit of, virtual environments with what we do on telehealth, etc. And that's, got various applications, whether it be kind of, in sort of sports performance sense or pain therapy or in a hospital. But we can maybe do some things with more immersive environments like that. But I think it's sort of a bit of a, let's not jump too far ahead moment. And as I said, I think we've got good technology there now, but we've got to make it connect better. That's kind of my immediate summary, if you want.
Yeah, you can probably talk about this for.
Yeah, we could for sure.
But that's great. Thank you, Mark. I think we've covered everything I wanted to there today. It was great to have you on and good to have a good, thorough chat about telehealth. So thanks again for joining us.
Good, mate. Thank you, Dave. And I'm glad we're doing these videos at the clinic. It's good.
All right. Thanks a lot.
Thanks.